Welcome back, and thank you all for staying with NTV Weekend Edition. I am Sandra Twinovideo and Susan Mujawananda on the sign language. Now, religious leaders are asking the president to consider setting to the National Health Insurance Scheme the bill into law immediately to enable more people to obtain affordable care. However, there are concerns that the law may have fundamental faults that are preventing the president from proceeding to sign it into law weeks after Parliament passed it. To share with us some of her thoughts on the matter is Allana Kembabazi, who's the program manager at the Initiative for Social and Economic Rights. Good evening and welcome to NTV Talk of the Nation.
Thank you, Sandra, and I'm glad to be here today.
Well, when you look at the National Health Insurance Scheme, first of all, the bill, do you support it?
I do support a national health insurance scheme, and the Initiative for Social and Economic Rights, which I work for, has always done so, for three reasons. And even in this particular bill, actually. One, the out-of-pocket costs for healthcare in this country are ridiculous. 41% of the healthcare costs come from people from household incomes. And we know that there are public health facilities, but they're not always everywhere, and they're still lacking, and we are pushing the government to really strengthen them. But the areas where they're not, people are going to the private sector. And you have an issue where, again, the fees in the private health facilities are exorbitant. Of late, we are seeing that people are being detained for failure to pay bills. In fact, yesterday, the Initiative for Social and Economic Rights filed a case on patient detention in health facilities. And the stories are everyday stories. This emergency happened. I had to go to this facility. Maybe there was no public facility near me, or it didn't have the things. I was taken to the private. They've treated me. I can't afford the bill. They're like, you can't leave. I have sold off all my livestock. One woman was telling us she brought from the village circle. It still wasn't enough. Now she's in debt to the village circle and the hospital, and her daughter was detained, you know. So that is the state of our healthcare with, again, a huge out-of-pocket cost burden. And so national health insurance is really to alleviate that, to say, how do we make sure that getting healthcare in this country is not entirely dependent on the money you have at the moment. And we know we have...
It's money you've saved over time, is that what you're trying to say?
Well, saved over time, but also the way national health insurance works is you pay, you know, either per month or per year, right? And you know that when you get sick, if today Allana gets sick and she only has 50K in her pocket, but she needs an urgent procedure of 1 million, she will be able to get it. It won't depend on that exact money you have on. But also the idea that the poor and the rich will subsidize the poor. Those of us who are healthy will subsidize those who get sick a lot and are elderly, for example. Because if you're all putting money into this pool, then over time, you know, people are able to get health care, and it doesn't mean that if, for example, I get sick all the time, I'm rushing the facility all the time, I am able to benefit from a situation where there's a pool of money that is able to make sure that, you know, I'm able to get money.
Well, you know, just to cut you short on that, when you keep on saying there's a pool of money, and I know majority of the people that cannot access proper healthcare are the poor people, people deep in the villages. Let us speak to those that are hearing the National Health Insurance Scheme for the very first time. How does it work? For instance, if I'm a farmer, how do I get to be part of that if it is assented into law? Now,
this bill that was passed by Parliament is very clear that if you cannot, and there are people in our society, we know what the bill calls indigents, they will not have any means. The bill is very clear that government must take care of those in this scheme, right? And then for others, they will assess contribution based on income. Now, we've had reports in the media, 4% is being deducted, 100,000. Those reports are false, because according to what we have before us, and you know, we can only speak with what we have before us, both the bill that was debated by Parliament and passed, and the report of the Health Committee of Parliament, they were very clear that the determination on premiums, what they call premiums, how much you will pay to contribute to be a member of, to be able to get the benefits of national health insurance, will have to depend on income, but it also has to be affordable. And there must be a study that informs that. Someone can't wake up and just say, we're deducting 4%, right? That is not fair. And then for those of you in the informal sector, for the formal sector, the employee will pay something, will contribute something, but the employer will also contribute something, because you should be contributing something for your employees' health. And so that is where the discussion around premiums has been. But it is the other thing that the bill says, particularly for the everyday person you're saying, there are lots of Ugandans who are just struggling to go to a public health facility. They don't even have the transport. The bill is also very clear that this national health insurance is not supposed to be the solution to Uganda's healthcare problems. that in fact we're supposed to have a strong public health sector. And the committee, when debating, the health committee in Parliament, was very clear that we must make sure that there are provisions that emphasize that the government cannot stop financing the public health sector. And this is a real concern because right now we've seen them try to cut the budget of the health sector in this current financial budget deliberations. And so the committee is saying you must have a strong public health sector, but you also must have national health insurance such that you are alleviating the pressure of Ugandans who, for example, will go to the public health sector, might find something that is not there, or go in the private facility and are still having to shoulder these costs because you don't plan when you get sick. Today you're okay, tomorrow something happens. And I think what COVID has really shown us is it's important that people are able to get health care, regardless of their socioeconomic status. It doesn't help you, Sandra, if for you get health care promptly and the market woman does not. How do you contain a pandemic when there's a huge percentage of people that don't get health care? And that's the reality right now in Uganda. Because in areas where, for example, there are no public health facilities and the private are very expensive and they're not there, the women stay home. I have met women who will tell you they start doing concussions, chlorophyll or whatever, and people just die uncounted like that.
Yes. Now, just we know there are concerns that are hindering the president from setting into law. In your own opinion, what are some of those?
One, I think that there's been this misinformation around the fact that the premiums have already been
owners out.
Yes, and that's going to raise the cost of business so extraordinarily that the premiums are so high. And I want to clarify this. First of all, there is a board that is supposed to be in charge of national health insurance, and the private sector is represented on that board. The trade unions are on that board, and Federation of Employers are supposed to send a representative on that board. So there's scope for them to actually influence the nature of the premiums that are deducted. But number two, there's this false dichotomy we have gotten, that it is either the economy and business or the ordinary conditions of Ugandans, healthcare, a livable wage. And what COVID has shown us is the two are intertwined. Right now, everything shut down because of a health issue. And we know for a fact that until we contain health in this country right now, until we arrest this pandemic, the economy is going to suffer. People are going to be out of jobs. The private sector will not be able to function.
But if you're to look at the medical personnel, are they even ready to operate in such an environment? That is one. Two, the health facilities. We still know that health facilities are still lacking. You get to a place, there's no medicine. Even the personnel is not motivated to work on you. Are we ready to operate in such an environment?
I think we have to get ready. First of all, one of the things that I do like about the National Health Insurance Scheme deliberations has been the focus on accreditation. We have this business where the Ministry of Health says 80% of people can get to a health facility. But what is the condition of those health facilities? Do they have drugs? Do they have qualified staff? If I have a private clinic here and is hiring, for example, midwives who have not finished school, or someone who purports to be a pharmacist but has not gone in training, is that quality healthcare? So the scheme is saying that anyone who takes part, any provider, public or private, must be accredited. They must meet certain standards. And again, it is really to make sure we are getting quality health care. Number two, in terms of sort of how insurance works, this is a national health insurance scheme where everyone is supposed to be part of and is going to be centrally managed. So you're not leaving the burden to the individual health facility to deal with, like, you know, for example, UAP or U-radio, so forth, right? Those are some of the modalities that definitely will have to be worked out to make sure that there is no huge administrative burden. But the benefit of this is that, again, it is a centrally managed scheme. There will be even regional boards. So it is definitely something that will have less of the administrative burden that a regular facility has dealing with, like, an individual insurance provider. Today you have UAP, then you have this, and you have this, and you have that, right? And number three, the issues you raise about and our health sector has serious problems because government has failed to actually adequately finance it, adequately steward it, and regulate the private sector. Those issues there are not going to be magically solved by national health insurance. But there are elements in this bill that try to, for example, regulation of providers, accreditation, and also the fact that the bill tells government, the committee says this to government, and even tries to have a clause there to say that government cannot just leave the health sector. Oh, we passed national health insurance. Wonderful. Thank you. The public health system must continue to function. because there are limitations to what will be covered. For example, in benefits, like, you know, with insurance, you go then up to a certain limit, certain things are not necessarily covered, right?
Yeah.
So that's why the public health system must continue to function. So the two of them are supposed to work together. The public health system is supposed to be there to make sure the most vulnerable can be covered, but national health insurance is to also alleviate these out-of-pocket costs that households are facing with healthcare. So I encourage the president actually to sign this bill. Those who have issues, when you look at the text of the bill, a lot of the debate has been around affordability premiums. Those things are not in the bill. You do have opportunity to influence them because they're supposed to be determined by actual studies. And lastly, the poor, like you've been emphasizing, and I've loved that about this discussion today, the most vulnerable must be able to get health care. They must be covered by government national health insurance, and they must be public health facilities.
All right. Thank you so much, Allana Kembabazi, the program manager at Initiative for Social and Economic Rights, joining us today to shed some light on the National Health Insurance Scheme bill that is yet to be assented into law by the president. Thank you as well for joining us. We'll be back shortly.
Thank you.